In this video, we will be discussing the danger signs and symptoms of lung cancer that you need to be aware of. Lung cancer is a serious disease that affects millions of people worldwide. And recognizing the early warning signs can make a significant difference in diagnosis and treatment. Join us as we explore the key symptoms, causes, diagnosis, treatment, and prevention strategies for lung cancer. Lung cancer is the leading cause of cancer-related deaths globally, accounting for approximately 1.8 million deaths each year. It affects both men and women, with higher incidence rates in individuals over the age of 40. Smoking is the primary cause of lung cancer, responsible for about 85% of all cases. However, it's important to note that non-smokers can also develop lung cancer due to other risk factors. Lung cancer is a type of cancer that starts in the lungs and can spread to other parts of the body. It often begins in the cells lining the air passages and forms tumors that interfere with normal lung function. There are two main types of lung cancer: non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. Non-small cell lung cancer, NSCLC is the most common type of lung cancer, accounting for approximately 85% of all cases. It usually grows and spreads more slowly than small cell lung cancer. Small cell lung cancer, SCLC accounts for approximately 15% of all lung cancer cases. It is characterized by the rapid growth of small cells that multiply quickly and form large tumors. SCLC is strongly associated with smoking, and it tends to spread rapidly to other parts of the body, including distant organs. The classic symptoms of lung cancer include persistent cough, chest pain, shortness of breath, coughing up blood, wheezing, unexplained weight loss, and recurring respiratory infections. These symptoms often develop gradually and can be mistaken for other respiratory conditions. Here are 10 warning signs that are commonly associated with lung cancer. 1. Persistent cough. A persistent or chronic cough that lasts for more than a few weeks is one of the most common symptoms of lung cancer. It may be accompanied by coughing up blood or rust-colored sputum. 2. Unexplained weight loss. Significant and unintentional weight loss without changes in diet or physical activity can be a warning sign of various cancers, including lung cancer. It may indicate that the cancer is affecting the body's metabolism. 3. Chest pain. Lung cancer can cause chest pain that is often sharp and worsens with deep breathing, coughing, or laughing. The pain may be localized or spread to the shoulder or back. 4. Coughing up blood. Coughing up blood, also known as hemoptysis, is a worrisome symptom that should not be ignored. It can range from small amounts of blood-streaked sputum to larger amounts of bright red blood. 5. Chronic respiratory infections. Frequent respiratory infections, such as bronchitis or pneumonia, that keep coming back or do not respond to treatment could be a sign of an underlying lung condition, including lung cancer. 6. Shortness of breath. Difficulty breathing or shortness of breath, especially with minimal exertion, can be a sign of lung cancer. This symptom may indicate that a tumor is obstructing the airways or affecting lung function. 7. Wheezing. Wheezing is a high-pitched whistling sound that occurs when air flows through narrowed or constricted airways. It can be a sign of lung cancer, especially when accompanied by other respiratory symptoms. 8. Difficulty swallowing. Lung cancer that affects the esophagus or compresses nearby structures can lead to difficulty or pain while swallowing, medically known as dysphagia. 9. Finger clubbing. Clubbing of the fingers, which involves the enlargement and rounding of the fingertips, can be a sign of lung cancer. It is caused by insufficient oxygen levels in the blood. 10. Exhaustion or fatigue. Feeling excessively tired or fatigued, even after getting enough rest, can be a symptom of lung cancer. This fatigue may be attributed to the body's immune response as it fights against cancer cells. It's crucial to consider the signs we have discussed as a collective whole, rather than treating them as isolated indicators. Please keep in mind that while these signs can raise suspicion for lung cancer, They can also be caused by various other conditions. If you experience any of these symptoms, it is crucial to seek medical attention promptly. Early detection and diagnosis of lung cancer can lead to more effective treatment options and better outcomes. If you found this information valuable, please consider liking this video and subscribing to our channel for more informative content on health-related topics. The primary cause of lung cancer is cigarette smoking, which accounts for about 85% of all cases. Chemicals in tobacco smoke can damage the DNA in lung cells, leading to the development of cancerous cells. The risk of developing lung cancer increases with the duration and intensity of smoking. However, it's important to note that non-smokers can also develop lung cancer. Other causes and risk factors include secondhand smoke. Exposure to secondhand smoke increases the risk of developing lung cancer, especially in non-smokers. Breathing in smoke from other people's cigarettes, cigars, or pipes can be just as harmful. Radon gas. Radon is a naturally occurring radioactive gas that can seep into homes through cracks in the foundation. Prolonged exposure to high levels of radon increases the risk of lung cancer. Occupational exposure. Certain occupations, such as mining, construction, and asbestos manufacturing, involve exposure to hazardous substances like asbestos, arsenic, diesel exhaust, and certain chemicals. Prolonged exposure to these substances can increase the risk of developing lung cancer. Air pollution. Long-term exposure to high levels of air pollution, including vehicle exhaust, industrial emissions, and fine particulate matter, can contribute to the development of lung cancer. Family history. A family history of lung cancer can increase the risk of developing the disease. Genetic factors may play a role in certain cases. Several pre-existing health conditions and lifestyle choices are associated with lung cancer. Here are some examples. Chronic obstructive pulmonary disease, COPD. Individuals with COPD, such as chronic bronchitis or emphysema, have a higher risk of developing lung cancer. These conditions often result from long-term smoking. Personal or family history of cancer, previous or current cancer in other parts of the body, such as the breast or colon, can increase the risk of developing lung cancer. Weakened immune system. People with weakened immune systems, such as those with HIV/AIDS, or those who have undergone organ transplantation, have an increased risk of developing lung cancer. Poor diet. A diet lacking in fruits and vegetables, which are rich in antioxidants and other beneficial compounds, may contribute to an increased risk of lung cancer. Lack of physical activity. Leading a sedentary lifestyle without regular exercise may be associated with a higher risk of developing lung cancer. It's important to note that while these factors may increase the risk of developing lung cancer, they do not guarantee its occurrence. Many individuals with lung cancer have no identifiable risk factors. If lung cancer is suspected, several diagnostic procedures may be used to confirm the diagnosis. Imaging tests, chest X-rays, computed tomography, CT, scans, and magnetic resonance imaging, MRI, scans, can provide detailed images of the lungs and help identify any abnormal growths or tumors. Biopsy. A biopsy involves the removal of a small sample of tissue from the lung for examination under a microscope. It can be done through various methods, including needle biopsy, bronchoscopy, or surgery. Sputum cytology. This test examines the cells in the sputum, mucus coughed up from the lungs, for the presence of cancerous cells. The treatment options for lung cancer depend on the type and stage of the disease. They may include surgery. Surgery is often the primary treatment for early-stage lung cancer. The goal is to remove the tumor and nearby lymph nodes. Different types of surgical procedures may be performed, such as a wedge resection, removal of a small portion of the lung, lobectomy, removal of a lobe of the lung, or pneumonectomy, removal of the entire lung. Radiation therapy. Radiation therapy uses high-energy radiation to destroy cancer cells. It may be used as the main treatment for localized lung cancer or in combination with surgery or chemotherapy. External beam radiation therapy delivers radiation from outside the body, while brachytherapy involves placing radioactive material directly into or near the tumor. Chemotherapy uses drugs to kill cancer cells throughout the body. It may be given before surgery to shrink tumors, after surgery to destroy remaining cancer cells, or as the primary treatment for advanced stage lung cancer. Chemotherapy is often administered in cycles, with periods of treatment followed by rest to allow the body to recover. Targeted therapy. Targeted therapy is a type of treatment that targets specific genetic mutations or abnormal proteins in cancer cells. These drugs work differently from chemotherapy and may be used for certain types of non-small cell lung cancer, NSCLC, that have specific genetic alterations. Immunotherapy. Immunotherapy helps the immune system recognize and attack cancer cells. It can be used as a treatment for advanced lung cancer, particularly non-small cell lung cancer, NSCLC, and may be used alone or in combination with other treatments. Immunotherapy drugs, such as checkpoint inhibitors, block proteins that prevent immune cells from attacking cancer cells. Palliative care. Palliative care focuses on improving the quality of life for individuals with lung cancer, particularly those with advanced stage or metastatic disease. It aims to manage symptoms, provide pain relief, and offer support to patients and their families. The choice of treatment will depend on factors such as the stage and type of lung cancer, overall health status, and individual preferences. Treatment plans are often developed by a multidisciplinary team of healthcare professionals, including oncologists, surgeons, radiation oncologists, and other specialists. While not all cases of lung cancer can be prevented, there are several strategies that can reduce the risk. Don't smoke. The most effective way to prevent lung cancer is to avoid smoking and exposure to secondhand smoke. If you smoke, quitting is the best step you can take to improve your health and reduce the risk of lung cancer. Avoid exposure to radon. Radon is a radioactive gas that can be found in homes, especially in basements and ground floors. Test your home for radon, and if levels are high, take steps to reduce exposure, such as sealing cracks and improving ventilation. Minimize occupational exposure. If you work in an industry with potential exposure to carcinogens like asbestos, diesel exhaust, or certain chemicals, follow safety guidelines, use protective equipment, and participate in regular health monitoring programs. Limit exposure to air pollution. Take measures to reduce exposure to air pollution, such as avoiding high-traffic areas, using air filters in your home, and supporting policies that promote clean air. Eat a healthy diet. Maintain a balanced diet rich in fruits, vegetables, and whole grains. These foods contain antioxidants and other compounds that may help reduce the risk of lung cancer. Exercise regularly. Engage in regular physical activity to maintain a healthy weight and improve overall fitness. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise each week. Get screened if at high risk. Individuals at high risk for lung cancer, such as current or former smokers, may benefit from annual screening with low-dose CT scans. Talk to your doctor about whether lung cancer screening is appropriate for you. Remember, early detection and prompt treatment play a crucial role in improving the prognosis of lung cancer. If you have any concerns or are experiencing symptoms, consult a healthcare professional for evaluation and guidance. In this video, we discuss the danger signs and symptoms of lung cancer, the causes and risk factors, diagnostic procedures, treatment options, and prevention strategies. Lung cancer is a serious disease that requires early detection and appropriate management. If you or someone you know is experiencing symptoms associated with lung cancer, such as a persistent cough, unexplained weight loss, chest pain, coughing up blood, or shortness of breath, it is essential to seek medical attention promptly. Remember, early intervention can lead to better outcomes. Thank you for watching. Give this video a like and don't forget to subscribe to our channel for more informative content on health-related topics. Stay healthy and take care.